Okay, so I'd like to say good evening to Mrs. Brandi Krenek, whom I've asked to join us this evening. Her profession is she is a nurse and she is housed at one of the middle schools in Dickinson, Texas. So I've asked her to participate in our chat tonight. This is a non-judgmental chat. I simply asked her as a nurse, excuse me, to share some of her feelings that she has experienced working with students and her environment, period, in terms of dealing with this pandemic for the past couple of years. So before we start talking about the students in respect to their mental health aspect, let's talk with you for a minute about the past couple of years as a nurse. How has it been? How has it impacted you, your work, and where do you think we go from here? How's that?
At the beginning of the pandemic, as a nurse, I was working in the hospital setting. And I came to the school setting in January of 2021. And it both hospital and school setting has been very stressful as far as the pandemic, because constant changing of protocol and the unknown, the constant changing with the recommendations from the CDC, and how this virus was spread, and just the unknown. And it's gotten better.
Did you freeze, Brandi?
Every month it's something different. And I feel like as a nurse, it was in the beginning, it was scary having two young ones of myself and my family to deal with. I didn't see my grandma for a while because I didn't want to be exposed to anything and spread it to her. So it impacted my home life as well as my work life in the beginning.
So,
But I mean, it's
Brandi,
gotten better.
how did you deal with all that stress?
You just take it one day at a time. I mean, you just hope and pray that it would just get better. And I mean, I would talk to my family over the phone. Finally, it got to where when I would go see my grandma, I would just wear a mask, because I couldn't imagine exposing my loved ones to something and them potentially lose their life over this. But that was the early stages of this virus. But because you didn't want to feel like responsible and exposing your family.
Yeah, I can only imagine working in a hospital setting, how stressful that could be. I mean, what you see going on around you all the time, 24/7, then having a family that you had to come home to, scared of the possibility that you may be bringing something home with you. I just can't imagine. I just can't imagine. And maybe that's why, I don't know if it's true or not, that because of the stress levels, that I had heard that there were a lot of nurses leaving the field. Have you heard that?
Yes. Because it's more of it. It's because of the environment that you work in. I mean, we were short staffed already. The hospital setting, you're always short staffed. So on top of having a pandemic, you would, I would float to I would be moved to the COVID floor at least probably once once a week, twice a week, um, because they didn't have the staff to take care of those patients. And so you're already short staffed. On your days off, they were calling you to try to see if you could come in and help because, I mean, the hospital, they had at least 2 floors that they changed to COVID floors in the beginning because we had so many. The ICUs they were full, so they were having ICU patients on regular floors. It was just crazy in the beginning. And so it was just stressful because you didn't feel like you had the administration of the hospital, you didn't feel like you had a support system at all.
Well, I can imagine why and how people would be stressed out about that. So what was it, if anything, that helped you make the decision to move to the school?
So before I even started nursing school, that's where I wanted to be, was a school nurse. But with specialties, you have to get your experience in other fields a lot of times before you can even be recommended to have a job in the school. And so, because you have to get your experience, and have that under your belt. So I had applied, and then I got it. So I was happy. It just so happened to fall in during the pandemic. I had even applied for school nurse jobs before the pandemic even started. So it just kind of worked out the way that I got the job right after the pandemic started.
Okay, so let me ask you this question. The stress level that you experienced working in the hospital, okay, and the unknown that you had to deal with. Now let's transfer those thoughts about what about the unknown of all the students that were coming in at that time during the pandemic? Was there no stress there for you?
Oh, there was. It was very stressful, but my job is to take care of, healthy individuals, sick individuals. I just, like I said, I had to gown up and I had to protect, or not gown up, but mask up and protect myself. And then we had procedures at the school. So that's why teachers call me before they send students, so I can protect the other students. If it's not an emergency and I have a student in the clinic, then I tell the teacher, look, I have a sick student in here that I'm waiting to be picked up, so I don't expose others.
Yeah, and that's a good plan. But I remember you see me every day, Brandi, and you see me I'm still wearing my mask.
Mm-hmm. And there's still some that do.
Yes, at the school. And the level of fear that I experienced during the height of the pandemic at the school was what in the beginning they shared with us when students were out with COVID-19, when teachers were out with COVID-19, and then there was, I guess it was something passed that said that we no longer have to let people know when students are out with COVID-19, unless you were directly involved with that student or teachers. And so I still find myself, because I have a compromised immune system with diabetes, wearing my mask because I still uh do my at-home test kits every week from when I get home from my school every Friday. I do my at-home test kit to make sure that I am not positive, because I strongly believe that, unlike a lot of people that I come into contact with, there's still a lot of deaths going on every day from COVID-19.
That's correct.
So let's talk about your feelings about what kind of impact the pandemic has had on specifically the middle school students. And I'm talking about socialization, isolation, their mental health aspects. Where do we stand? Where do you see us?
I see a lot of students that they lack social skills. I mean, when I came to the school, they were still having students where they were able to just do virtual learning. Well, so what, over or a whole school year, students weren't interacting with other students.
Right.
They were stuck at home, and a lot of times their parents had to go back to work. So they were just at home either by themselves or with, other loved ones. And I feel like that what I've just seen the students around me, they don't they don't have they don't know how to socialize. They have social anxiety when, when students start coughing in their class. They get anxious, and I've had parents call me, well, my student had a student coughing in their class and now they're scared to come back. And I have to explain to them that, it's okay if your student wants to wear a mask if they feel safe
Right.
wearing a mask, which we do have students that wear a mask every single day. But there's also, you have to remember, there's allergy season,
Right.
and we're seeing a lot of that, especially with these cold fronts blowing through, and students they're anxious. Teachers are anxious. They're sending me students all the time. Oh, they're sneezing, they're sniffling, they're coughing. And I mean, if I feel like that they're okay to go back to class because they don't have a fever, I usually assess them for a while. And if they cough maybe once or twice, okay, then it's not consistent. But I just feel like everybody's on edge because, either they feel like they have to cough and they're scared to cough, or if somebody's coughing, then they're anxious about it. I had a student start handing masks out to other students in her class because somebody was coughing. So that makes that student feel isolated because now, she's coughing. I mean, she could be just coughing over. She was actually choking on her water, and another student started handing out masks.
So
So
how
how
do
does that
you
make her
calm those
feel?
fears?
I don't know. I feel it starts at home. When parents are anxious, then I think it rubs off on their children. And I asked that student, I said, where did you get all these masks from that you're carrying in your backpack? She got them from home.
Hmm. Well, I think that uh, it's good to know that it's good to know that I'm not the only one who is unsure or unaware of what is going on really in our environment, because we don't know.
We don't.
We don't know. And when there are times, Brandi, when I go to the food banks and I hand out my COVID-19 flyers with information on the latest booster or where they can get it. And like right now, they are talking about ending the free vaccine shot in, I believe it's like May of this year. And so I tried to go to the food banks to uh, hand out this information, but also let people know that the end is coming up. And so if you're thinking about getting a vaccine or a booster and not having to pay anything out of your pocket, you might want to do it sooner rather than later. But as I'm handing out some of these flyers, I also hear family members say, COVID-19, it's a hoax. I am not getting a shot. My children are not getting shot. Keep your flyer.
Yeah. Oh, in the beginning, it was hard when I had to quarantine students because of exposures. I mean, parents were not happy, and I mean, they got ugly. And I would just tell them, look, I don't make the policies, I don't make the procedures. I just have to follow what I'm told to do.
Mm-hmm.
I mean, there's still some people that still don't believe COVID-19. Out of
Right.
all these deaths that
Ex-
they've seen, they
Exactly.
still don't believe it. And that's another reason why I still like the teachers to call me, because if there's a student that's coughing or has a real bad sore throat, I still mask up if I'm going to be looking in their mouth, because I still have to protect myself and my family too.
Exactly. Exactly. And the hard part is that uh some of these students and some of the teachers um they get so in your space. They get so close in your space. And I find myself at least backing up, or asking the student, there was a time when we would freely give hugs. Uh, that's a no-brainer for me now. It's like, no, we can bump elbows. We can
Mhm.
bump elbows, but the hug action, I am not there yet. And I feel badly because I think it contributes to how students may feel a little isolated,
Mhm.
so I don't know. I don't know what to do. And I appreciate your honesty too. What about do you see a decline in their mental health, or is it normal, or what?
I feel like, first of all, the maturity levels from the last 2 years being in the school setting. So the fifth graders, when I came on in 2021, they're so much more mature than the fifth graders I have this year and even last year. And I don't know if it was because of, they were in what, third grade or so when this pandemic hit. So I don't know if that contributes to kind of their maturity level and how they process and how they cope with different things. But I mean, like they'll just come and they'll cry if they have a headache, and they always want to go home.
Hmm.
And I feel like that they're so used to, with COVID, you know, it's like any little symptom, you're going home in the beginning. Or parents just use that as an excuse not to send their kids.
Hmm.
And I mean, like I have this one student, he has uh, uh he has different medical diagnoses, but he wants to be in school, but he's homeschooled
Hmm.
because family's worried when he comes back to school, the exposures. But
Right.
he wants to be with his friends. And that's what a lot of kids miss, being with their friends. And so I think it hurts the kids because their family, some families take advantage of this, and not, they take advantage of it because they just don't have to bring their kids to school. But
Mm-hmm.
it's hurting the kids. But this year it's different as the procedures, because if you are COVID positive, you stay out for 5 days and that's it. And then you mask day 6 through 10.
Hmm.
Whereas in the beginning, you could be out for 20 days, because if, say, mom was positive, you'd have to be out for 10 days, because you can show symptoms after exposure 2 to 10 days after exposure. So that's 10 days, and then 10 days. Now dad's positive, 10 more days.
Uh-huh.
So it was just, so I think parents took advantage of it in the beginning, or they would just, we didn't require a positive, any proof. If you had symptoms, stay home.
Mm-hmm.
But now you have to have proof in order for your absences to be excused.
Okay.
And so I think that's helped students' absences, and parents aren't just, going to come pick them up for every little thing. But it's like, there's no, either parents don't want to send them, or parents send them when they're sick and then I have to send them home.
Hmm.
But it just, it doesn't help with kids' coping mechanisms. They don't know how to cope
I
with
agree
it.
with that. I agree with that because I see that every day. They don't know how to um, have a conversation. They don't know how to have a conversation. They don't know how to be respectful to each other. And everything is said in anger. And I'm not sure where this anger is coming from, except that the like you were saying earlier, had an impact on their social skills. I think the fifth and sixth graders that I deal with are lacking in social skills. And thank goodness that's part of the curriculum I teach, but it's like I only meet with them 7 times, and what they learned or what has been unlearned in those 2 years, 2 heavy years of this pandemic, it's very sad. It's
Mhm.
very sad. Not only academically was there a decline, but socially there's been a decline. And there, as far as I'm concerned, they're under that umbrella of mental health, all aspects of it uh, is on the decline. Is on the
I agree.
decline. You said you agree?
I agree.
Oh, thank you. Thank you. So, how do we get it back?
That's a good question.
Yeah, because, as I said, we get information from the CDC, we get information from John Hopkins Hospital. That's a good place for research with
Mhm.
COVID-19. But then you have people like certain areas of the country who are very, very, very committed non-vaxxers who are feeding misinformation. And so I'm not sure where we go from here. Because when you have a child who repeats what mom and dad says or repeats what mom and dad believe, then it's just like moving down generational. No, it doesn't happen, never happened. I didn't have it. It's just a cold. Whatever. Whatever. I'm not sure where we go from here.
I I don't know. I mean, we have to back science, I guess. And that's where I tell them, look, I can't I can't help with what you believe, but this is what I have to go by. Everybody has different beliefs on a bunch of different subjects, but my job it's science based. I mean, research based. I mean, I have to go by what in my profession, I have to, research backs it up. And I mean, and have I ever questioned it? Oh, yes. You start hearing things and you're like, okay, is this really happening? But at the end of the day, I've seen it. I've seen what it's done to, you know, young adults in the hospital, 42-year-olds having to go up to the ICU on a ventilator because they can't breathe. So it's like you have proof, and it doesn't, I mean, you and I can, all we can do is just teach these children, how to cope, get their social skills back. And I mean, being on their cell phones and texting all the time too, that doesn't help with communication. They don't know how to have a conversation.
Exactly. Just before I got on the Zoom meeting with you, went for my walk at Walmart. I walk every day at Walmart after work. And Brandi, I can't tell you, adults on their cell phone, kids on their cell phone, everybody's on their cell phone. Everybody,
Mhm.
and I know kids bring their cell phones to school. They're not supposed to use it, but I know as soon as that last bell rings and it's time for them to go home, they pull those cell phones out. I just can't imagine. I just can't imagine. So I'm not sure where we go from here. Um, I do believe there's still possibilities of more surges to come, more surges to come. I'm not sure what we're supposed to do with uh once you have all the boosters and your 6 months of coverage has run out with the boosters. I'm not sure. That's all the unknown.
Right.
And how does one relieve their minds with all of the unknowns?
Live
Mask up
one day at a time.
one day at a time and keep masking up.
Right.
So let me put it to you to have look, it's 5:28, Brandi. So let me ask you if you have anything that you'd like to say to the public about COVID-19, about the pandemic, about one's mental health, making sure that you take care of yourself. You have the floor.
Just continue to wash your hands, mask up if you feel like that that's what needs to protect you. But hand washing is so 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 important. I mean, you don't realize where germs are. Handles, a pencil. I mean, I'm constantly washing my hands. And just try to stay positive. There's an end to this, I feel. And I feel like that it's going to end up being like flu, where you can get the booster shot every year. But I just don't let it consume you. Don't let your anxiety consume you, because it's hurting you and those around you, especially the children.
Very good. And I will add, um, as an adult, we need to check in with our mental state as well. Talk to your friends. Talk to, if you go to church, talk to the clergy. Reach out to a therapist, a counselor. Uh, don't be afraid to make sure you take care of your well-being. These are trying times which call for uh, drastic measures to make sure that we are all okay. Brandi Krenek, Mrs. Brandi Krenek, I want to thank you for being part of my Zoom chat, and I appreciate the time that you've devoted to us tonight.
No problem. Thank you. Thank you
Yeah,
for chatting with me.
yeah, I enjoyed it. And have a great evening.
All right, you too.
All right, bye-bye.